Hello and very warm welcome to the Canada News with your host Divya Roy. Now let's take a look on the headlines. Andrea Horwath leader said Premier Ford has always made political decisions. Brampton MP Gurratan Singh said the city was in the midst of an epidemic. MPP Sara Singh and Kerry Mia targeted the Ford government. Now news in detail. Andrea Horwath, leader of the opposition in the Ontario Legislative Assembly, has said that Premier Ford has always made political decisions and is now shifting the blame onto Ontarians who have questioned the apology offered by the Prime Minister. Reid demanded paid sick leave and vaccination in hotspot areas to save the province from the epidemic.
I saw the Premier pointing fingers at everyone else and not taking responsibility for the mess that he's dragged us into. I mean, our province is being ravaged by COVID-19 because the Premier was apparently listening to political insiders and watching the polling as opposed to listening to the advice and recommendations of the science table, and that's not new. We know that that's been the same way that the Premier's handled things from day one, and that's how we ended up in this terrifying third wave. Certainly we would have been in a third wave, there's no doubt, but the extent to which our province is spiraling out of control really sits with the decisions that this Premier made and didn't make to save lives and to stop the spread. He didn't take any responsibility for that today. So in terms of the apology, it's up to Ontarians, to decide whether they accept it or they don't. But what we needed today was action. We needed the Premier to step up, bring in the paid sick days, make sure that we're closing non-essential businesses and supporting them through these next several weeks, and make sure the vaccines are getting to the places where the virus is spreading out of control. We need a paid sick day program that is timely. People don't have to wait, that they don't have to jump through any hoops, and that it actually covers their pay. It's pretty simple. Those are three principles that have to be part of this plan, and of course it's a plan we should have seen many months ago, and we still don't see it. But it does absolutely have to be on time in terms of people's pay. The pay cannot be reduced. It has to be fully compensating people's regular pay, and they should not have to jump through hoops to try to qualify. I mean, it has to be pretty straightforward and easy.
Brampton MP Gurratan Singh said the city was in the midst of the epidemic and the lack of healthcare was a problem, but they did not take steps. Test capacity was not enhanced by the pilot project and opened despite the playground. That is why the positive rate is the highest in the city today.
Our hospitals are at capacity, our ICUs are at capacity. We have one of the highest positivity rates in the entire province right now, 22.4%. And quite frankly, this is a crisis that could have been avoided. Doug Ford and the Conservative government led us straight into this crisis because in February, when we heard very clear from the health experts that we were heading into a third wave, that we were going to reach 5,000 to 6,000 cases a day, at that point, instead of doing the right thing, instead of bringing in paid sick days and ensuring we have a proper restrictions in place to stop the spread of COVID-19, the Premier, Doug Ford, did the exact opposite. He opened up our province and he voted time and again against paid sick leave. He refused to give Brampton, a hotspot, access to the life-saving vaccine that we need to fight COVID-19. When he launched his pilot project of 325 pharmacies across Ontario, not one was included in Brampton. He left us behind, just like how he left us behind early on in the pandemic, when Brampton did not get the testing capacity that we needed or access to the PPE. So we're here today to have a discussion with the other MPP folks, other NDP MPPs in Brampton, and talk about how drastic the situation is and how really it's something that we need to all speak with a unified voice. We need to come together right now and demand. We need to demand from Doug Ford, because the buck stops with the Premier, Doug Ford, We need to demand from him paid sick days. We need to demand access to the vaccine that we need for our community. And we need to demand the resources we need to stop this pandemic, which is ripping through our community right now. You know, the fact is we represent a huge part of Brampton, and we each have unique perspectives that we can share with all the folks who are watching right now about what's happening in our city and the advocacy that we need. Now, a lot of you, we all kind of touched on this idea on Friday, how last Friday we saw the science, we saw the modeling was going into the direction that we knew was going to happen because of the announcement happened in February. And we knew at that moment the Premier, Doug Ford, he had the opportunity then to show real leadership, to actually show the fact that, you know, we need to bring in things like paid sick days and supports for workers and small businesses and vaccines to hotspots. Instead, I think the entire province was just completely floored with his response. And his response was extra police powers that the police didn't ask for and shutting down playgrounds. Now, I received numerous calls, numerous DMs and messages across the board in response to people who were just like, he lost the mark. It didn't make sense.
During the town hall, MPP Sara Singh and Kevin Yard also targeted the Ford government, saying the government had consistently ignored Brampton and that the fair share vaccine had not been introduced. Double the province of vaccines are needed, but the city had 8 pharmacies per million people, fewer than Mississauga and Toronto, while COVID's influence is greatest in the city.
You know, last week we saw such a disappointing announcement from the Premier, just a complete refusal to acknowledge the state of crisis that we're in. Instead of actually getting us measures like paid sick days, we saw them close down playgrounds, introduce a police state, and yet people in Brampton continue to struggle. And it's absolutely disheartening to see the response from this government, or should I say a lack of a response to address the crisis that we're in. You know, our ICUs are over capacity. People are being shipped out of our community into neighboring hospitals, even as far as Kingston, we're hearing. People are being airlifted out of our communities. It's a dire strait that we're in. And like you said, Gratin, this has been, since the start of the pandemic, we as a community have been neglected and left behind by this Conservative government. Whether that was making sure that we got access to the testing that we needed, making sure that now our community has our fair share of vaccinations, or whether it was actually increasing healthcare capacity for our community, the government really didn't address the problems that we have here in Brampton meaningfully to help us get through this. And now we find ourselves in a third wave. Record-breaking numbers of cases in our community, workplaces being shut down because Dr. Lowe is showing some leadership for our city and for our region and taking action because the Conservative government didn't.
Our positivity rate is 22.4%. This is more than double the provincial average, which is around 7.9%. 10% is bad, 15% is horrific. We are at 22.4%. So the fact that we are the highest positivity rate in the province, we should be getting the vaccines. We should be getting the pop-up clinics, which we don't have. We should be getting all of these services in Brampton. If you look at the pharmacies in Brampton, we have 8 pharmacies per 100,000 residents. Toronto has 9, and Mississauga has 10, and Kingston has 26 pharmacies per 100,000 that are putting vaccines into arms. This is not right. We should be getting those vaccines into our pharmacies, and that's one thing I'm going to continue to push at Queen's Park. And, you know, the government has to listen to their science table. Their own science table was telling them back in February that we needed paid sick days, that we needed to close non-essential businesses. But at every turn, they did not listen to them. What did they do? Of course, they closed down playgrounds, and they also brought in a police state, which thankfully all of the police associations said no to this, and because they know the best way to eliminate and save people in Ontario and Brampton through the pandemic is not by making a police state, but rather by bringing in paid sick days and all these other things that we've been talking about.
NDP leader Jagmeet Singh addressed a virtual meeting calling for government action to save a Laurian University. In fact, the Subtree Ontario Institute is eliminating 58 undergraduate and 11 graduate programs, as well as 110 vaccines, in connection with which a virtual meeting was held in the town hall.
Thanks so much, Charlie. And Franz mentioned this as well. I mean, it's so clear what Laurentian University means is something really unique and really special. The combination of having a space, an institution dedicated to higher learning, specifically one of the best programs around Indigenous learning, and one that was founded with the input of traditional knowledge keepers and elders. The quality of that experience and the indigenization of the institution, you can see it as a really special place, combining that as well as being a space for Francophonie and a space for the North, created something really special and really unique, and really also highlights why the federal government has to play a role here. We can't just let the federal government sit by idly when an institution that directly would impact the improved quality of life for Indigenous people directly is access for Francophone communities. C'est essentiel, ça souligne l'importance pour le gouvernement fédéral d'agir de maintenant pour sauver les programmes. So it's so important, and why I take my role really seriously, that we've got to protect this institution for what it brings and what the special thing they were building around creating that tri community element, that tri culture. It is very special and something we've got to defend.
Thanks. Ginny McFarland has written, I don't know if people had a chance to read her statement, but I think it speaks to so much of our experience in the North. I know so many people who have no opportunity to go down south. It's possible to go to Laurentian, but to go further south is very difficult. And Ginny McFarland writes that she's worried about the cuts to arts, mathematics, physics, the ability to have a proper master's program is actually about de-skilling the North. That where we had an institution that, again, working class people could get skills, highly trained, and then work in the field of the North, that we're now going to have to be relying on people with graduate degrees from elsewhere because of this happening. Franz, I was wondering if you had any thoughts on that, given the how many people come into Sudbury from across the North to get educated.
Brampton South MP Sonia Sidhu asked Federal Minister Anita Anand about vaccine procurement and distribution, as well as how the federal government provided assistance to the Union Territories and provinces during the third wave in Canada.
You and your officials have been working non-stop for well over the past year to protect the health and safety of all Canadians. My first question is to Minister Anand. Can you tell the committee about the update we just received from Pfizer and how this will impact the government's vaccine procurement and distribution plans to provinces and territories?
Well, thank you so much for the question, and I'd be pleased to share the good news from Pfizer today. We have negotiated the exercise of an additional 8 million options with Pfizer, so that means that not only are we purchasing these options, but they're going to be delivered in the very short term. We expect to have 2 million doses of Pfizer delivered in May and 12 million per over 5 weeks in June. So 2 million per week in May, 12 million doses of Pfizer over 5 weeks in June. In addition to the other vaccines in our portfolio, this means that we are going to cumulatively have between 48 and 50 million vaccines in this country prior to the end of June. And I just want to reiterate that when we put our contracts into place last summer, and indeed our portfolio is a diversified one with multiple contracts and multiple suppliers, we wanted to make sure that we had access to multiple sources of supply of vaccine. So we are pulling vaccine now, not only from Pfizer, but also from Moderna, also from AstraZeneca, and also from J&J. And I think that that is what is very important. And if I could simply clarify a point about our rankings, I was speaking about the G20, whereas I believe that my honourable colleague was speaking about.
Nova Scotia Premier Ian Rankin has announced that provinces are get some gathering rules that will increase the fine to 1,000 or 2,000 for breaking them. He also said that restrictions would be further increased in view of public health measures. He said that these rules would remain in force till May 20.
Yeah, it's been a tough couple of days for sure for our province. Dr. Strang and I have been on some daily phone calls, especially over the last 48 hours talking about the situation. We're worried. Our COVID cases are climbing at a rapid rate. We're reporting 63 cases today, the highest count ever since COVID entered our province. And 52 cases on Saturday, so we're seeing multiple days of double-digit cases. This is concerning and very serious. I don't like the trend I'm seeing. And while the majority of cases are in Halifax area, it is now spread to every region of the province. The virus is spreading and we have to find a way to contain it. Large social gatherings in the middle of the lockdown are not helpful. I was infuriated to find out about a household gathering, a party, in Halifax in the middle of a lockdown. Dr. Strang and I are both so frustrated about this irresponsible behavior. Why? Why would you put yourself at risk? And worse, someone else. It may be fun in the moment to gather with friends who have no concern for COVID. But how would you feel if you put a loved one in danger who cannot fight this serious disease? We were relieved to hear that police acted quickly and issued fines. But the current fine does not seem to be enough of a deterrent. So we're doubling our fines from $1,000 to $2,000. I want to thank our regional police for understanding the seriousness of these gatherings and acting in the best interest of Nova Scotians. I also want to thank the majority of Nova Scotians that are listening to public health protocols and showing up in droves to get tested. Dr. Strang and I are grateful for those that are continuously cooperating with the protocols, and seeing the long lines of people getting tested is heartwarming. I just saw another line at the convention center on my way in today. The vaccine rollout is continuing, and I'm also grateful for those who are going out to get that shot in the arm. All of this is helping, but sadly, it isn't enough. COVID loves movement and social gatherings. So the only way to slow the spread is if we limit our movement. We have already asked you not to travel in and out of the Halifax area, but we need to take this further.
As Canada struggles with the third wave of COVID-19, a World Health Organization consultant gave a message to Canadians that dawn is coming. Dr. Peter warning comes at a time when Canada is being badly affected by the third wave of COVID-19. Province Ontario is going through a particularly terrible time.
WHO has fought day and night to end it. And the defining issue really for 2021 is vaccine equity. We say vaccine equity both within and among countries, but globally, Mercedes, almost 1 billion doses of vaccine have been distributed. 83% of those have gone to high-income countries and upper-middle-income countries. And there's a very, very inequitable distribution. And that means that the pandemic is raging in places, variants are being produced, and none of us is safe. And so it's very important to get vaccines around the world and to combine them, of course, with public health measures in the 1-2 punch to defeat the pandemic. Is the ACT Accelerator, the COVAX vaccine pillar, which, by the way, is celebrating its first anniversary this week. It has distributed more than 40 million doses of vaccine around the world. The Government of Canada has been a very active and positive participant financially and in terms of its engagement in the COVAX and in the ACT-A, and that's very much appreciated. I think with vaccine equity, there's really 3 issues: dollars, doses, and domestic manufacturing. In terms of dollars, Canada's been a very good contributor. There's still a $19 billion shortfall in ACT-A, and that's compared to trillions of dollars of stimulus spending around the world. So that's a great buy. In terms of doses, it's very important actually for countries that have doses to share them. France recently announced that it would start sharing doses, because it doesn't matter if you have money if you don't have vaccine doses to distribute. And then finally, vaccine manufacturing domestically, at least at the regional level, which is an issue for Canada and for every country around the world. For example, in the budget, there was money for domestic biomanufacturing in Canada, and that's an issue for every country around the world.
Tickets were issued to several people after police raided a party in Toronto. Police said they received information about 30 people were gathered at 12:20 p.m. But no information was given about the whereabouts of these people. Investigators said the police had given the party fees the access point, but a person living near the police had to go on the occasion. Queen Street and Gladstone Avenue again said that when the police reached the area, they saw dozens of people running down the street. The man identified as Stott said he looked like he was returning from a party. All were ready. He said 4 or 5 police vehicles were parked on Queen Street when he took the dog for a walk around 2 p.m. Stott said people responded politely to the police, and after being asked to leave the area, they left. Another neighbor said he saw 40 to 50 people on the streets. The police officers were running after people with flashlights. In Ontario, the COVID-19 vaccine will now be available to pregnant women on a priority basis. The province has made pregnant women eligible for the COVID-19 vaccine, placing them in the highest risk category. The province has made the change in light of new data which states that pregnant women should be also eligible for the COVID-19 vaccine. The risk is much higher. The second phase of the province vaccine rollout plans puts pregnant women at highest risk. Health units in Ontario are currently vaccinating the highest risk and highest risk variants. Pregnant women can get the vaccine from the immunization clinic by calling the provisional call center and booking an appointment. Pregnant women who are not using the provisional booking system in health units will be asked to book an appointment through their local units. Brampton Mayor Patrick Brown is once again reiterating calls to prioritize the vaccination of essential workers following the tragic death of a 13-year-old girl from the city last week. Emily Victoria died on April 22, days after the first exhibiting symptoms and 5 days after testing positive for COVID-19. She is one of the youngest Canadians to die after contracting the virus. According to the Globe and Mail, Emily lived in an apartment in Brampton with her parents and her brother. Her brother and mother are also sick with the virus and her mother is in hospital. Her father is an essential worker working at a warehouse to support their family, and his family got COVID. So that's all we have in this edition. Thanks for watching. Stay tuned for more updated news.